If you want to alleviate pain, take for example in the case of hip osteoarthritis, where the patient is experiencing pain, you apply a longitudinal distraction, then you oscillate. Your oscillation has to be rhythmic, and you need to get feedback from the patient if the pain is being alleviated or not. You can also distract and do vertical oscillation for the hip joint. But in my clinical experience over the years, I have found longitudinal oscillation to be more effective than the vertical oscillation. So oscillate, it has to be rhythmic with small amplitude. And these alleviate principles through the principle of the gauge theory of pain. If your oscillation is rhythmic and of small amplitude, grade 1 or grade 2, it will stimulate the mechanoreceptor faster, and this refutes, this alleviates pain through the theory of gauge pain. You can also do your oscillation by flexing the knee fully, then flex the hip to 90 degrees, then adduct a little. Then you do a vertical oscillation of grade 1 or 2 oscillation to alleviate pain. Generally, your mobilization has two effects, and these two effects are what we know as the mechanical effect and the neurophysiological effect. The mechanical effect is that your mobilization has actually stimulates the flow of blood and fluid into that area that you are oscillating. And this brings about essential healing materials and nutrients which will assist in the healing of that area where you have that pathology. So the mechanical effect is actually a stimulating effect which stimulates blood flow and fluid to that area, supplying essential nutrients and materials that are essential for healing to take place. And by the time you vascularize that area, you also have a way of washing away the irritants that are actually stimulating the nociceptors to bring about pain. So it has a washing effect, clearing that area of all irritants, and also supplying nutrients. And the neurophysiological effect is that of your pain gauge theory. Your stimulation, your oscillation actually stimulates the mechanoreceptors. The mechanoreceptors are fast conducting fibers because they are myelinated, they are thick and large in diameter. And these characters actually makes them to travel faster than the nociceptors. So when you oscillate, you stimulate the mechanoreceptors, and this travels to the higher center at the level of the substantia gelatinosa. And when it gets to this hypothetical gate, it has to inhibit passage of impulse coming from the nociceptor. So it actually inhibits the pathway of nociflexors that will make the patient not to experience pain. And that's the neurophysiological effect of oscillation or mobilization techniques.